Hi, it's Cindy. Today we're going to look at the codebook, ICD-10 PCS codebook. This is my codebook, so you're going to see some notes and things like that. And then I'll just reference the things I want you to be able to find if you're in your codebook. You see where I have tabs for the major body systems. I don't have everything tabbed. In the back, there's several things that we will not be doing in this course and that I seldom use. But I do code the major body systems so that I can quickly reference them in my codebook. As I think I mentioned to you in a previous podcast, I use the tables. I don't use the index very much, but I am going to talk about that a little bit. So I go straight to the body system once I've identified which body system it is and which root operation it is. Okay, so open your codebook. The first thing you're going to see is I do have notes to myself. This is just some general information reminding me about certain things, and then I have some information from the PCS reference manual. The reference manual is on the content page under additional resources if you want to look at that. The next thing I have tabbed are the body systems that are in the codebook. I'd recommend that you either tab this in your codebook, or I'm sure they're listed in your textbook as well, so you have quick access to know which body systems are available for you. Then I have a note to myself, just reminding myself of things like the pulmonary vein, the pulmonary artery, the aorta, the superior vena cava are all in the heart and great vessels body system, not in the upper vein or the upper artery. This is just a little reminder to me. And then the inferior vena cava is in the lower veins. So these type of things that on first flush I might think they go in a certain body system, and then I learn later they go in a different body system. This helps remind me, that's all. And then on the next page, I have the different root operations noted, and then little things that I want to remember that repair, the root operation repair, like not elsewhere classified in your diagnosis coding. If there's anything more definitive that you can code, a root operation that's more definitive, to code the other root operation and not repair. Then I have like coding clinic reminders. This is the fourth quarter 2017, reminding me that I can use control as a root operation, even if active bleeding is not documented in the chart. On this page, I have reminders about devices. We don't code devices unless they remain after the surgery. Then this is a reminder about devices as well, and insertion as a root operation. On this page, more information about root operations based on the objective of the procedure, which is the same thing as what is the intent that I mentioned in some of my other podcasts. Then there are additional sections. Most of what we use in this course is the med-surg section, medical surgical section, which is section 0 value. The first character would be a 0. The obstetrics section, the first character would be a 1, and there are different meanings to those characters when you get into these different sections. Placement is section 2. Administration section 3. We do use some of these in this course. Measurement and monitoring section 4. Extracorporeal or systemic assistance in performance section 5. And extracorporeal or systemic therapy section 6. Osteopathic section 7. Other procedures section 8. Chiropractic section 9. I don't label these in my tabs because we seldom use them, but I do label imaging, which is down at the bottom, this imaging section, because we will be using that from time to time. And then it continues with more sections that I'm not going to be covering in this podcast. The next thing I want to bring to your attention are the descriptions of the appendices. You will be using the appendix. Appendix A is just talking about the surgical procedure itself. B are all your root operation definitions. There's several ways you can reference this. There's a quick guide for root operations under additional resources in week 1. There's also the Haugen Academy has a flip bits that you can buy on their website, and what it does, it gives you basically the same thing. You've got your root operation, some definitions, and some examples. It's just a tool. It is not required in any way, but it is there. If you are interested in it, let me know. So you've got your code book, the tool under additional resources, the Haugen Academy's flip bits, all those things to help you always have the definitions of the root operations at your fingertips, because we have to apply the full definition of the root operation in order to use it. The body part key you will use in finding out what PCS calls something. So you read it in your operative report. You don't find that body part in PCS manual, so you go to the body part key to see how PCS defines it. Then the device key and aggregation table under Appendix F is when you're going to be looking up some of those devices that you see in the operative reports. And those are the things you're going to be using most often. There is an Appendix J for hospital-acquired conditions. That's covered in more depth in your 220-221 course. I encourage you to take advantage of the coding exercises. They have the exercises in one part of the manual and then the answers in another, so that you can test yourself. Okay, the next thing I want to talk about in the code book, just to quickly go through a few things. Under additional features, Medicare code edits, we looked at those more in ICD-10 coding, CM coding, diagnosis coding, but they are also applicable in PCS coding. The sex edit symbols you're going to see as the male and female symbols. Let me move this up a little bit. I'm not cutting that off. The male and female symbols here, the non-covered procedure, there's an NC in the red box, and in limited coverage, there's an LC in the blue box. If you're doing hospital coding, you will be aware of edits. Anytime an edit hits, the A coder, either you or someone else in your coding department, has to resolve those edits. You have to determine, okay, why did that hit? Why is the system recognizing that as a problem? And you go back and you figure out why. That's a job that a more experienced coder is going to be doing, but it is important. For the hospital-acquired conditions I mentioned earlier, there is such a thing as a hospital-acquired condition-related procedure, so that if you've got a patient with a hospital-acquired condition and it requires a procedure, then that is a hospital-acquired condition-related procedure. And that is something that is in a yellow code bar in your code book. There's other annotations listed here I won't go over because we won't apply them very much. The guidelines are listed here. In the code book, you will see in a bold font those things that are new. For example, B17 is new for 2019. And there's other things as well. So just be aware that I have recorded 4 podcasts that just talk about guidelines. I encourage you to take advantage of them. You will not only learn the guideline, but I will give you examples of when you would apply that guideline. And in doing so, I'm assigning codes. So you get that extra practice. Here's your index for the PCS codebook. Your main term in the PCS codebook can be the root operation. It can be the name of the procedure. It can be a body part. So really similar to ICD-10-CM, you're going to be trying different things as your main term. And once you find them, you'll see, for example, under alteration abdominal wall, it gives you 4 characters to take you to that table in order to begin your work to assign the code. Next thing I want to do is talk about the tables. As we leaf through my code book, you are going to see notes similar to this that I have to remind me of things I want to remember. I like the Optum codebook, and the reason why I suggest it is because of the wonderful illustrations that are in it and some of the explanations that are given. Whenever you see all these references to Coding Clinic, you see the years are here and the quarter. That's because when you are a coder, you will have access to Coding Clinic and you will review it every time it's published 4 times a year, so that you can make adjustments to anything you've been coding that the information in the Coding Clinic is going to affect or impact. Here's an example of where I have written in my code book to help me remember the characters. For example, when I'm doing a bypass surgery, that fourth character is the number of coronary arteries, and the seventh character is the source of the blood bypassed from your, whatever you're coding, where is it bypassed from, the source of the blood. On my page, you can also see where I have, this is a reference to a coding clinic if the saphenous vein is acting as a coronary artery. And here's a reminder to always code the harvesting of the veins that you're going to be using for your grafts in a bypass surgery. When we talk about swim lanes or rows, this is a swim lane going straight across. When you're assigning a code, you cannot jump between swim lanes. So just keep that in mind as you learn to use your code book. That's it for now. Be sure and watch the podcast that I've made available for you. If you have any questions, please post them in the discussion board. I want to make this material as understandable as I can, and any suggestions that you have to help me do so, I'm willing to listen. Please don't get behind. There's a lot to read. There's a lot of homework. There's review quizzes, all of it reviewing what you're learning from reading the textbook and watching the PowerPoints. Thank you so much and have a good day.